Now, the new high-tech treatment for varicose veins. There's no surgery involved. It's relatively pain-free and it can be done in just an hour.
It was horrible and the pain was very, very bad.
I was most affected at the rear side of my legs and the hamstrings. I couldn't sleep at night.
They can be unsightly, incredibly painful, and in the past, their removal was difficult.
That was really horrible operation, very, very painful, and they came back.
Now the new technique that specialists claim is so quick, you can get it done in your lunch break.
It's walk in, it's walk out.
I'd go to work and I'd just suffer in silence, just not tell anybody, that I was in pain. I used to just cover my legs and not show them at all.
Sonia Saranki has battled with varicose veins for the last 2 decades. At the time when they initially surfaced, she underwent complicated and painful surgery.
Having that surgery back then was worse than childbirth. And I've had 5 children and 3 cesareans. So it was really bad.
A year and a half later, they were back, even worse than before. She'd given up hope until a co-worker informed her of endovenous laser, a quick, surgery-free procedure available that she claimed had worked for her. Sonia immediately made an appointment. The endovenous laser procedure is far less invasive and involves a laser probe being inserted into the leg and threaded through the vein while the patient is wide awake. The laser is slowly withdrawn, causing the walls of the vein to close.
Patients are awake. It entails a very small sting initially, it's just like a bee sting for the local anaesthetic. The laser is inserted into the vein, switched on, and the vein is then sealed. Afterwards, a bandage is applied and they're back to work.
Dr. Zil Yassin is the director of the Vein Institute, a medical clinic dedicated to the treatment of varicose veins. He sees hundreds of patients each month with varying degrees of varicose veins.
We scan their legs to determine the source of the varicose veins and then discuss the treatment options. Not everyone needs surgery or laser treatment. Some people are fine with just compression stockings. After that, we'll discuss what will actually occur in the treatment plan. It's often a matter of using laser in one session and then injecting their legs with medication on the second session. So it really does depend on the patient's veins. The treatment is obviously tailored to the patient's needs.
How quickly did you notice a difference in your veins?
Straight away. Had a bit of bruising, but when you take your bandages off, after about 3 days you can take them off and notice it straight away. I walked out and it was great. I'm really happy because I can go to work and I can not feel like go, oh, my legs are killing me.
While varicose veins are commonly attributed to women, many men battle the same problem. Timothy Graham was one of them.
I had gone to a traditional vein specialist at a big hospital and I'd asked about these new procedures and they had told me that they don't work. I felt that I needed to investigate that further. Spoke to my doctor about it and I'm so pleased that I did something different with it.
Timothy underwent the laser procedure last year and claims the result was immediate.
My legs look fantastic now. It's like I've never had varicose veins before. I had my final examination on the weekend and the doctor pulled out the photos and we were both quite shocked at how much it had improved.
So your veins are looking much better and the black veins have actually disappeared. Laser treatment has a success rate of approximately 98% over 5 years. They're tried and tested, they're safe, they're effective, they don't require any time off work and they're considered the gold standard currently.
If you have the old style surgery, it certainly is a longer recovery period, more complications, still very effective however and still is appropriate for some people.
Cardiologist Dr. Ross Walker believes that in many cases the new laser therapy is very effective, but he says there are always risks with any medical procedure.
Very rarely people can get infections in that area and very, very rarely, and much less common than say things like surgery, you can get clots in the veins and in the bigger veins because of the operation. We're not saying someone should just book in for the endovascular therapy. What they should be doing is seeing a phlebologist who is a vein specialist and getting that phlebologist's opinion, who will give them individualised opinion based on what they have.
As for Sonia, she believes she's made the right choice.
I just want people to know that you don't have to suffer in silence. You know, you can get something done. Men and women can get something done about their legs.